Good afternoon. My name is Ashley West. Can you say your name for the record, please?
Good afternoon, Ashley. My name is Ken Mori. You can call me Kentucky.
And what is your candidate number, please?
My candidate number is 23050246447.
Thank you. And you are taking this test as a nurse, is that correct?
Correct.
Thank you. Can I see your ID, please?
Sure. You may please.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
Okay.
Discuss your personal attributes that make you especially qualified for the nursing job.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Tell me about a time when you had a conflict with a supervisor. How did you handle it?
In a position I worked in previously, we used a specific method for checking in patients that I felt was outdated and inefficient. At an appropriate time during one of our staff meetings, I made several suggestions that I thought would improve the process. The supervisor was specifically looking for ways to increase efficiency, but disagreed with my opinions about the check-in process. He didn't utilize any of my ideas and didn't change the intake process. I continued to use the old system and, even though I thought our patients would have been served better by a new method, let the issue drop as it wasn't worth having contention in the workplace.
Do you wish to work in emergency nursing?
Yes, sure. It is because, when I was in high school, I drove my mother to the emergency room because she was having an allergic reaction. The emergency room nurse was very responsive and reassuring. I would like to make a similar contribution to my patients' lives.
How do you handle crisis situations?
I had an encounter with an elderly patient who was yelling loudly because the doctor had refused to increase her pain medication. I calmly listened, told her I was sorry about her discomfort, and asked if there was anything I could do to help. She started crying and told me that she was more upset about her family not calling to check on her. I encouraged her to reach out to them, which she did, and it turned out they were not even aware of her hospitalization.
If you know your supervisor is 100% wrong about something, how would you handle it?
It depends on the situation and the personality of the supervisor. For example, my prior supervisor was more easygoing, and if I told her, I think it might work better if I do what you asked in such and such a way, she would say, okay, try it.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hello, good evening. My name is Ken Mori, one of the registered nurses in the clinic.
Hi, good evening.
You seem to be very anxious. If you don't mind, may I know what's bothering you, please?
My mother has been diagnosed with dementia, and I'm really upset about caring for her.
All right. Don't worry. We are here to help you. Before proceeding further, may I know your name, please?
My name is Ashley West.
All right, Miss Ashley. Dementia is not a specific disease. It is a condition or state of the impairment of at least two of the brain functions such as memory loss and judgment. So you may have to face some challenges.
Challenges? Can you please make it clear?
Patients suffering from dementia will be having difficulty in completing familiar tasks, communication problems, misplacing things, confusion, and getting lost, etc. Hence, it will be difficult for you to understand her and help her.
She has shown these symptoms multiple times and that made me come here.
Yes, I can really acknowledge your situation. Patients with dementia should be provided with utter care, not just for their well-being, but for the family and society.
Oh God. How may I take care of her?
I can explain that for you. At first, in case she gets lost somewhere, it will be difficult for you to find her. So some precautionary measures should be taken immediately.
What are those measures I should take, nurse?
I will give you some ideas on it. Precautionary measures to be taken such as a GPS-enabled watch to track her if she gets lost, an ID necklace to show her identity, home security measures to prevent her from going out of the home, etc. Measures like this will be very helpful.
Yes, I got it. That's clear.
As the days pass, there will be some behavioral change with your mother. You and family should be aware of it and should be prepared to accept the changes.
You mean that the condition of my mother will get worse?
As I said in the beginning, this is an impairment in the function of the brain. Currently, your mother is in the initial stage of dementia. As the degree of dementia changes, there will be some unacceptable behavioral changes.
Can you please give me an example as you said before?
Sure. Ashley, don't get upset. This is a reality and you should accept it. You should also convey this to your family, and together you all should be prepared to face it.
All right.
Behavioral changes like mood changes, becoming suspicious or agitated for no reason, loss of bladder and bowel control can even occur.
Oh my God. Please.
Ashley, don't get emotional. This is part of dementia. She is absolutely unaware of this happening, and moreover it is beyond her control.
No, please.
You and your family should be the helping hand for her. What she needs right now is utmost care, and the care should be given for her helplessness.
Millimeters. Okay. Nurse, I don't know what to do. Please guide me.
Here onwards, she needs attention. You should provide assistance for her to complete daily routines. She won't be able to express her health issues, her needs, etc., so proper health checkups and personal care should be provided. In these initial stages, it will be manageable by you. But, later stages of dementia, you may require the help of a home nurse to look after her.
All right, nurse. I understand. Can you please give me information on how to care for a dementia patient, please?
Definitely, I can give the details regarding it. I can provide you with a patient care leaflet. All the information you are looking for will be available in it. I can also assure that, if you need any care assistance for your mother, please feel free to contact us. We can provide home consultation and home nurse facilities.
Thank you, nurse. Good to hear that.
You are very welcome. Do you have any more queries?
Not at the moment, nurse. Thank you for your guidance and for providing these valuable information.
No worries, Ashley. It's my duty. Feel free to contact us in case of any assistance. Bye, take care.
Bye. That is the end of your speaking role play. Thank you, Kentucky.
Thank you, Ashley.